Part 3. Vascular smooth muscle. The mechanical driver of blood pressure, arterial stiffness, and airway constriction. In Part 1, we discussed the glycocalyx, the protective sensing layer. In Part 2, we discussed endothelial cells, the signaling control layer. Now in Part 3, we discuss vascular smooth muscle, the mechanical layer that actually determines vessel diameter and blood pressure. These smooth muscle cells sit beneath the endothelium and form a circular ring around blood vessels. When they contract, vessels narrow. When they relax, vessels widen. This determines vascular resistance, which directly determines blood pressure. What are vascular smooth muscle cells? These are involuntary muscle cells located in arteries, arterioles, microcirculation, pulmonary vessels, kidney vessels. They work automatically and continuously maintain vascular tone. Unlike skeletal muscles, no conscious control, slow sustained contraction, energy efficient, regulate diameter continuously. They are the final step in blood pressure control. How vascular smooth muscle controls blood pressure. When smooth muscles contract, vessel diameter decreases, resistance increases, blood pressure rises. When they relax, vessel diameter increases, resistance decreases, blood pressure falls. This is the mechanical driver of hypertension. What controls vascular smooth muscle? They are controlled by endothelium, nitric oxide, nervous system, sympathetic tone, hormones, angiotensin, adrenaline, inflammation, metabolic signals. Among these, nitric oxide is the most important relaxant. Role of nitric oxide. Nitric oxide is released from endothelial cells. It diffuses into smooth muscle and reduces calcium, relaxes muscle, dilates vessels, lowers blood pressure. When nitric oxide is reduced, smooth muscle stays contracted, resistance increases, hypertension develops. This links endothelial dysfunction to hypertension, smooth muscle overactivity, and hypertension. In many patients, vascular smooth muscle becomes hyperreactive, chronically contracted, thickened, less responsive. This leads to persistent hypertension, reduced circulation, increased cardiac workload. Over time, structural changes occur. Vascular smooth muscle calcification. A major cause of arterial stiffness, smooth muscle cells can undergo calcification. This means calcium deposits form in the arterial wall. When this happens, arteries lose elasticity. Arteries become stiff. Arteries cannot expand. This is called arterial stiffness. How calcification causes hypertension. Healthy arteries expand with each heartbeat. Calcified arteries cannot expand. Pressure rises sharply. This causes systolic hypertension, widened pulse pressure, increased cardiac strain. This is common in aging, diabetes, kidney disease, chronic inflammation. Why smooth muscle calcifies? Under stress, smooth muscle cells transform into bone-like cells. They begin depositing calcium, phosphate, mineral crystals. This is called vascular smooth muscle osteogenic transformation. In simple terms, arteries begin behaving like bone. Causes of vascular smooth muscle calcification: chronic inflammation, insulin resistance, diabetes, kidney dysfunction, high phosphate levels, magnesium deficiency, vitamin K2 deficiency, aging, oxidative stress. These lead to arterial stiffness. Role of magnesium. Magnesium blocks calcium entry, prevents calcification, relaxes smooth muscle, improves elasticity. Low magnesium promotes arterial stiffness, hypertension, vascular calcification. Role of vitamin K2. Vitamin K2 prevents calcium deposition in arteries, directs calcium to bone. Without K2, calcium deposits in arteries. This increases arterial stiffness. Hypertension, bronchial smooth muscle, connection to asthma. Smooth muscle also surrounds the bronchial airways, just like blood vessels. When bronchial smooth muscle contracts, airway narrows. This causes wheezing, breathlessness, chest tightness. This is bronchial asthma. Mechanism of bronchial asthma. Three processes occur: bronchial smooth muscle spasm, airway inflammation, mucus production. The most immediate cause is smooth muscle constriction. This is similar to vascular constriction in hypertension. Nitric oxide and bronchial smooth muscle. Nitric oxide also relaxes bronchial smooth muscle. Low nitric oxide leads to airway constriction, asthma symptoms. This is why nitric oxide supports both vascular relaxation, airway relaxation. Magnesium and asthma. Magnesium relaxes bronchial smooth muscle. This is why magnesium is used in severe asthma attacks. It reduces bronchospasm, improves airflow, relaxes airway muscles. Magnesium helps both hypertension and asthma. Role of vitamin D, K2, and magnesium in preventing vascular calcification. Vascular smooth muscle calcification contributes to arterial stiffness and hypertension. Balanced calcium metabolism is important to prevent this. Vitamin D increases calcium absorption. Vitamin K2 directs calcium into bones and prevents arterial deposition. Magnesium blocks calcium entry into vascular smooth muscle and helps maintain elasticity. Together, vitamin D3, K2, and magnesium help reduce vascular calcification, improve arterial flexibility, and support healthy blood pressure. Smooth muscle dysfunction, a systemic problem. When smooth muscle regulation is impaired, it can cause hypertension, arterial stiffness, reduced circulation, bronchial asthma, pulmonary hypertension, kidney perfusion issues. This is system-wide smooth muscle dysfunction. Can smooth muscle dysfunction be reversed? Yes, especially early. Most effective approaches: nitric oxide support, magnesium, exercise, heat therapy, NJAR therapy, anti-inflammatory diet, glucose control. These help relax smooth muscle. Role of exercise. Exercise increases blood flow. This increases shear stress, nitric oxide release, smooth muscle relaxation. Regular exercise improves vascular elasticity. NJAR therapy releases nitric oxide, improves mitochondrial function, relaxes smooth muscle, improves circulation. This supports both vascular and bronchial smooth muscle. Diet that supports smooth muscle health. Leafy greens, beetroot, garlic, onion, omega-3, magnesium-rich foods, fermented foods, K2. Avoid glucose spikes, processed foods, excess inflammation. Complete vascular model. Layer 1. Glycocalyx, sensing layer 2. Endothelium, signaling layer 3. Smooth muscle, contraction layer 4. Calcification, stiffness. Damage progression. Glycocalyx damage. Endothelial dysfunction. Nitric oxide reduction. Smooth muscle constriction. Smooth muscle calcification. Arterial stiffness. Hypertension. How to detect arterial stiffness? Arterial stiffness can be measured using pulse wave velocity and related devices. These tests measure how fast pressure waves travel in arteries. Faster wave speed indicates stiffer arteries. Non-invasive devices such as PWV, KVI, and augmentation index monitors can detect vascular stiffness even before hypertension develops. But there is an easy way to know the arterial stiffness clinically at home. Pulse pressure, the difference between systolic and diastolic pressure, reflects arterial elasticity. Normal pulse pressure is usually below 50 millimeters of mercury. When pulse pressure exceeds 60 millimeters of mercury, it often indicates arterial stiffness and reduced vascular compliance. This pattern is commonly seen in vascular smooth muscle calcification and contributes to systolic hypertension. Conclusion. The three-layer model of hypertension. To understand the root cause of hypertension, we must understand the three layers of blood vessels. The innermost layer is the glycocalyx, the protective sensing layer. When healthy, it detects blood flow and protects the vessel wall. When damaged, inflammation begins and vascular signaling is disturbed. Beneath that is the endothelial cell layer, the control center. These cells produce nitric oxide, regulate blood pressure, prevent clotting, and control inflammation. When endothelial function is impaired, nitric oxide decreases and vessels begin to constrict. The third layer is the vascular smooth muscle, the mechanical layer. These muscles contract and relax to control vessel diameter. Overactivity causes vasoconstriction and hypertension. Over time, calcification of smooth muscle leads to arterial stiffness and persistent high blood pressure. Thus, hypertension often develops in sequence: glycocalyx damage, followed by endothelial dysfunction, followed by smooth muscle constriction, followed by vascular calcification and arterial stiffness. This three-layer vascular model explains many chronic conditions, including hypertension, cardiovascular disease, kidney disease, and even bronchial asthma through smooth muscle dysfunction. The encouraging message is that all three layers can be supported by reducing inflammation, improving nitric oxide, supporting magnesium levels, maintaining balanced calcium metabolism with vitamin D, K2, and magnesium, and improving lifestyle and metabolic health. Protect the glycocalyx, support the endothelium, relax the smooth muscle, and prevent calcification. And we address the root causes of hypertension. Thank you. Founder, Holistic Wellness Foundation. Impulse, healing beyond boundaries.